Toxoplasma gondii may be lurking in your home. It is responsible for 60 million infections in the United States and can cause problems in those who are immunocompromised. Please be on the lookout. Toxoplasma gondii is a member of the Protista kingdom and is an obligate intracellular parasite. It absorbs nutrients by burrowing into the host cell of mammals. T. gondii requires 2 hosts to complete its life cycle and causes the disease toxoplasmosis. Cats are the major hosts and vectors of T. gondii. Cats can become infected with Toxoplasma gondii by coming in contact with other mammals' infected tissues. The oocytes are then shed in the cat species and become infected in 1 to 5 days. The oocytes become infected by sporulating into sporozoites. Once sporozoites, the cells from T. gondii invade most kinds of tissue and begin to multiply asexually. Once reproduction has begun, pseudocysts are present in the host cells. The pseudocysts burst to release tachyzoites, which are matured sporozoites. After a few days, the tachyzoites, now called bradyzoites, reproduce more slowly and shell cysts are formed in the tissues of the host. A cat becomes infected by coming in contact with these cysts in the tissues of the infected mammals. In the cat, the cysts continue to mature. First they become zygotes, then oocysts. The oocysts become sporonts and then sporoblasts. The final step of the cycle is when sporoblasts mature into sporozoites, which are infected. Toxoplasma gondii is common. It is estimated that 90% of the people in France are positive. 50% of the people in Germany are also positive. Asia has lower instances of infection, but in the US, as high as 70% of the people are infected. Once a mammal has become infected, T. gondii can invade and hide in almost every type of tissue. It is estimated that 60 million people in the United States alone are infected with T. gondii, and 50% of the world's population is also infected. The CDC reports that T. gondii is responsible for 750 deaths a year in the United States. The CDC also reports that T. gondii is responsible for about 225,000 infections and 5,000 hospitalizations in the United States. About 80 to 90% of infected people with T. gondii have no symptoms. Due to its ability to transmit across the placenta, it is estimated that about 3,500 newborns in the United States are infected. T. gondii targets immunocompromised patients such as those infected with HIV or AIDS. Symptoms of infection include headache, fever, nausea, seizures, lack of coordination, and confusion. T. gondii may also be responsible for behavioral changes and encephalitis as well. Pregnant women are at risk for contracting T. gondii and transmitting it to the fetus transplacentally. Because of this, pregnant women are advised to not come into contact with cat feces or to use extreme precaution when doing so, such as through changing the cat's litter box. There are a few different ways humans can get T. gondii. One way is through eating undercooked meat of an animal who is infected. Another way humans can get T. gondii is coming in contact with infected feces of a cat. T. gondii can also be transmitted transplacentally or through blood transfusion and organ transplants. T. gondii infection can be avoided through thoroughly cooking meat, avoiding contaminated food or water, and also using precaution when handling cat feces. Treatment for toxoplasmosis is usually not needed in healthy individuals. Anti-toxoplasmosis drugs may be given to newborns who have contracted congenital toxoplasmosis. Some of these medications include daraprim and sulfadiazine. Those infected with HIV or AIDS who have a T. gondii infection may require hospitalization and long-term care.